Hey folks, welcome back to Transplant Helper again today. My name is Jim Burrell, and today we're going to be talking about a very, very important subject when it comes to medication management, particularly surrounding your anti-rejection medications. Now, for most of us, albeit there's a little different pattern for all of us, for most of us, we're either on medications something like CellCept or Prograf, aka tacrolimus, the generic version of such, or your own medications like Myfortic or microphenolic acid. And of course, it has its parallel also. But generally speaking, that's basically in the beginning the major two anti-rejection medications that we will be on. Add to that the corticosteroid prednisone that probably held you down for about a year or so post-transplant, maybe longer, maybe for life. Those are the medications we're oftentimes on shortly after transplant. Again, there will be variants to that, but that's kind of the basic 2 or 3 that the majority of us are on as a whole. Well, with that being said, I get asked questions often by people who say, well, Jim, I'm having terrible side effects, gastrointestinal issues, headaches, lightheadedness, fatigue, dizziness, and on the list could go surrounding one or more of those medications. For example, with prednisone, it often comes down to the mood swings. It comes down to the anger, feeling like you're going to go Hulk smash on somebody on a regular basis. Or maybe you do. I don't know. But they talk about the side effects. They talk about the issues. They talk about the problems, the difficulties. And they say, Jim, I'm just fed up. I want to quit the medications. I don't want to have to take that the rest of my life. The doctor said I had a good match anyway, so what does it even matter? Well, when someone asks that question, the first thing I want to ask them is, are you planning to do that under your doctor's supervision? Because if you're planning to taper a medication or maybe drop a medication under your doctor's supervision, then go for it. Give them a call. Tell them the issues you are having. Tell them about the problems. Tell them about the difficulties and all the pains of it. Let them know about that. And if they suggest that you maybe lower a medication or kind of taper it off or do away with it, trade it out for something else, go ahead and do that. For example, one of my major medications I dealt with in the very beginning was one of those major drugs, Myfortic. In the beginning, I had a lot of gastrointestinal issues when it came to Myfortic. Just to be plain about it, pretty much every morning in my life, I woke up, popped my medication. I think at the time there were maybe like 4 or 6 of those little blue pills, different kind of blue pill. Pop those pills, and within a few minutes, nauseated, just, stomach pains, sick at my stomach, be in the bathroom, having the great old D word, diarrhea that we don't talk about, and that would go on throughout the day. And maybe about lunchtime or a little after, I would get some relief, but then I would turn around and eat a meal. That would exacerbate things again, or maybe it would get all the way till nighttime. Time to take the medication again. It would happen again. That's some of the issues I dealt with in the very beginning. I can remember many, many times in the early stages of that, within the first few months of transplant, looking at my medications and looking at the side effects, maybe on a Google search, and saying, okay, this medication is doing that one's doing this one's doing this over here, but the main culprit for all of this in here was the Myfortic. I didn't want to take it. And I remember many times picking up that literal bottle and kind of shaking my finger at it and saying, you know what, I'm done with you. Me and you are breaking up, and wanting to put that down and not wanting to take it. Even up into the point, there was actually a morning or two where I looked at it and I thought, you know what, I'm not going to deal with that today. I've got other things to do. I can't spend the day in the bathroom, so I'm not taking you today. Thankfully, by about lunchtime, I kind of came to myself and went ahead and took the medication, albeit late, but I would generally go and do that. But finally, after a period of frustration and just anger, I finally spoke with my team as if it had never happened to anyone. And immediately, my coordinator said, no problem, Jim. If you're having problems with Myfortic, we'll give you microphenolate acid. It's kind of the first cousin of that. Generally speaking, either one person will do really good on one on the other. Obviously, we'll do some blood work to make sure there's not any problems with that your levels stay consistent. And obviously, we're going to watch for rejection on the change, but just try that, see how it goes. I mean, almost within a week after changing from the one medication to the other, things gastrointestinal at least began to resolve themselves. And thankfully for me, the med levels look good. I've never experienced any rejections, so I kind of rocked on about my day. Having similar problems, however, with the Prograf, the tacrolimus medication. Never took CellCept, but with that, having similar problems with that. But what was the thing about that? They began to taper it over time, and things got better. Prednisone, same story. Hulk smash moments, had a difficult time emotionally for a long time. Once I came off of that, it tapered, and I came off of that, things got better. So I would encourage you, if you're having issues with medications, make the first plan of attack to be contact your team, reach out to your coordinator, reach out and sit down with your doctor and say, look, this is the problems I'm having, whether or not they're part of the Google side effect or not. This is what I'm dealing with. These are my issues, and this is how frustrating it is. What are my options? What are some things we can do to change? Are there some medications we can swap in and out? Can we go ahead and start tapering this medication and see how it goes? Generally speaking, they're going to be very open to that, and I promise you, it'll make a huge difference. Because see, here's the real outcome. I'm going to draw a picture. Let's use me. I'll use me. Wouldn't want to use you. I love you too much for that. Let's use me. Let's say that I decided back, it would have been 7.5 years ago now. Let's say that I decided, you know what, my Fortic is a big problem for me. Not going to call my doctor. Not going to try to get swapped to microphenolic acid, which was ultimately my resolution. I'm not going to do that. I'm throwing the bottle away, and I just reach and grab the bottle, turn it around, throw it over here in the trash can, let it go, don't order it. What would be the outcome of that? What are the possibilities of that? Well, let me tell you what could happen. What could have happened, in essence, was the fact that I could have been in rejection. Look at me closely. It's all possible and statistically likely that if you cease from taking your anti-rejection medications, that you could be in some form of rejection within 48 hours, okay? 48 hours, you could be in some form of rejection. Now, whether or not that's going to be R1, which would be mild, whether or not that's going to be R2, which would be moderate, or whether or not that's going to be R3, which would be severe, you could actually go into rejection within 48 hours of ceasing or lowering that dose of medication too far. So don't ever consider stopping a medication again without your doctor's approval, without your doctor's guidance and leading you down that path. Don't ever do that. In addition to that, I'm just going to say this plainly, if you go into rejection, say, for example, I stop my medication, I go into R3 rejection, which again could happen within 48 hours, I could die from R3 rejection within 24 hours if not tremendous medical care be put into that. Without me going in and having IV treatments and other things done. Of course, you're going to turn around, they're going to put you on huge doses of those medications and others. You're going to pay the price for that eventually if you want to live. It's certainly not worth it. But someone says, well, Jim, wait a minute now. You're talking about minor type, and by minor, we know it doesn't feel minor, but you're talking about minor side effects. You're talking about gastrointestinal. You're talking about the headaches. You're talking about being fatigued every day or maybe some difficulty breathing from these things. What about the long-term effects of this, Jim? Isn't it the case that things like Prograf, Myfortic, or microphenolic acid, prednisone, isn't it the case that does permanent damage to your body, particularly when it comes to your liver and your kidneys? Doesn't it do damage? Isn't it possible, and I've said this before again, the likelihood of getting cancer within 3 years post-transplant is also a number of, I hate to say it out loud, about 80%. Now, obviously, that's going to be skin cancers and stuff most of the time, but the potential is there for that. Couldn't it cause me to go into kidney failure or liver failure? Couldn't it cause these issues? Yes, it could. But let's draw that scenario out. Which one looks better to you, okay? Which one looks better? Is it better to, over a 5, 10, 15, 20-year period, have a slight degradation, anyway, having your organs, kidney and liver, to be injured? Isn't it better over a 5, 10, 15-year period to have slowly that decay of those organs, that failure of those organs, than it is to go into organ rejection within 48 hours, death within 72, because you decided not to take it? Which one's better? Do we want to have organ failure aside from our original failure, which for me was my heart? No. But the truth is I do. The truth about me is I actually have cirrhosis of the liver. Okay, I've been diagnosed with it several years ago. I have cirrhosis of the liver, and they say that it's most likely that was caused by two factors. Number one, I was in heart failure for 38 years of my life before transplant. Born congenital, always a little bit of heart failure to deal with. That's one factor, obviously a big one. But two, my cirrhosis of the liver came about because of some of the medications I'm on, like Prograf, like tacrolimus, like microphenolic acid eventually. My liver failure is a result of that. The cirrhosis is a result of that. But which is better? Is it better to have a slow digression or, failure of my liver as opposed to having an immediate failure with my heart? Yeah, I'll take liver failure any day. Even draw this illustration out further. Again, these are just scenarios. I'm not saying this happens or will happen, but it could. Is it easier for me? Let's suppose that I take medications for 10, 15 years. It damages my liver, damages my kidney to the extent now I need a kidney transplant or now I need a liver transplant. Is it logically easier to get a kidney transplant, a liver transplant, or a heart transplant? Now, keep in mind, to get a heart transplant, you've got to have a deceased donor, non-living donor. That deceased donor had to have died in some way, whether it be through a stroke or a head injury or some other way, whereas the heart itself was not damaged to the point that it was usable, whereas they were able to stay on life support or some other means in long enough to get the heart, to recover it from them and to get ready to transplant it into you. Is it more likely to get a heart transplant in that scenario or to get a kidney transplant or maybe a liver transplant where not only do you gain from deceased donors, but oftentimes and more times than not, you can gain from a living donor, even a family member who may have a blood and tissue type match with you could donate a kidney or could donate you just a part of their liver to help you survive, to help you live on, instead of going through heart transplant. So do I feel like sometimes I don't want to take my anti-rejection meds, Prograf, microphenolate, that sort of thing? Do I ever feel like that? Yeah, I do. I really do. Side effects can be overwhelming sometimes, frustrating every time. But I tell you what, the outcome and the potential of stopping that is much more dangerous, much more severe, even in the long term, than just taking it consistently, keeping in touch with my doctors, keeping in their advice, allowing them to make some swaps, some adjustments, and some tweaks to hopefully make my life easier symptomatically. And then at the end of the day, sometimes just accepting, okay, I'm not going to feel great every day. And yes, I'm slowly over time, I may end up needing a kidney transplant. But the potential and the long-term effect of that is much farther out and it's much more of a sure thing that you can do that than this. Because again, you give a team of doctors 48, 72 hours to find you an organ out of thin air, they may not do it. Just take your meds. You already knew that. So did I. Just think things through. That's all I ask. I appreciate every one of you. Stay stronger, friends.